Thank you everyone for joining us today on our webinar covering getting started with MIPS reporting. We're going to wait just a few more moments for additional folks to join and then we'll begin. All right, thank you again for joining us today on this webinar, How to Get Started with MIPS Reporting. We are MIPS Pro, or you also might know us as Healthmonics, and we are an organization that provides a MIPS reporting solution, but also provides a lot of information and educational material to help eligible clinicians to be prepared for and successfully report for MIPS and other CMS quality initiatives. So we're happy to have you join us today and go through the information we have prepared. Whether you are new to MIPS or have already dug into MIPS, this is where you want to be to get valuable information and an actionable plan to get started with MIPS reporting. And I'll go ahead and recognize that we are into 2018, so hopefully you have begun something with MIPS. If you haven't, that's okay. We're going to spend time to set the groundwork, make sure you understand MIPS as a program, and what steps you can take to get started and complete reporting before the submission deadline. So with that said, as we go through the material here today, I'll answer some of the housekeeping questions. You can access the webinar slides that we go through in the handout section of the GoToWebinar toolbar. So just use that drop down. You'll be able to download those handouts and view them at a later time or share them with others in your practice. The webinar today is also being recorded, so you will receive by email a recording of the webinar along with the webinar slides and link to some of our resources and materials that you can continue to reference as you begin reporting MIPS. So with us today, my name is Philip Spence. I'm a sales consultant here at Healthmonics. We also have my colleague Christina Zink, our communication specialist.
Hello.
And we'll be taking you through this information here today. We're also going to save time at the end for some questions. So as we go through this information, please feel free to ask questions using the questions toolbar in the GoToWebinar tool. You'll be able to type in your questions. We can answer them as we go, but we'll also answer them aloud and discuss to make sure everyone can get the benefit of those questions. So what we like to do is actually take a moment to understand more about our attendees as well. So I'm going to introduce a brief poll. And there's going to be a few questions we'll go through just to gain an understanding of who is with us today and help us draft our approach or adjust our approach to make sure we're delivering the information to you in the most helpful manner possible. So you should see a question pop up on your screen. And the first question is, what best describes your role within your organization? If you could just take a brief moment, click on the option that best represents you, and then we'll share the results. All right, we're just going to wait one more moment for additional responses. Okay, and we'll close out the poll and take a look at the results. So the majority of attendees on the call are practice administrators or some type of administrative role within their practice. So that tells us that you might be working with one or multiple clinicians and looking at MIPS and understanding the reporting requirements for those clinicians. If you're in a quality improvement role, that might imply that you're working with a slightly larger organization or more eligible clinicians. Might be looking at this from a scope of other programs that you're using reporting mechanisms for as well. We don't have any identified clinicians on the call, so we'll keep that in mind as we address this information, understanding your roles and looking at the different aspects of MIPS. So thank you there. We're going to go on to the next poll question, which is, on a scale of 1 to 5, how comfortable are you with MIPS? So 1 being not that comfortable and 5 being very comfortable. On a scale of 1 to 5, how comfortable are you with MIPS? in another moment, and we'll close the poll out. Okay, and let's take a look at the results. All right, as one might imagine, we have a pretty nice bell curve here with the majority of you in the middle, fairly comfortable or reasonably comfortable with MIPS, some of you not that comfortable, and some very comfortable. So I think that tells us we'll make sure we cover all the bases, make sure we set the groundwork, as I mentioned, with the MIPS reporting requirements. But please know, if you are very comfortable with MIPS already, ask the questions that we might not address. We'll make sure we can either address those immediately or come back to those more specific and finite questions about MIPS reporting, so you still get the same benefit out of investing time with us here today. Okay, so next poll question. Have you started reporting MIPS? Just a yes or no, have you started reporting MIPS? All right, just one more moment here. And we'll close out the poll and share the results. Okay, so it's pretty close, with the slight majority of attendees having not started reporting, but a good amount, 46%, having already started to report. So that's good. A good amount of you have begun. Again, if you have just begun, this will still be valuable. If you're almost done with MIPS, this can still help you address some questions you might have before submitting or finalizing your MIPS information. Okay, one last question, then you can sit back and relax and enjoy the rest of the presentation we have for you. And that last question is, what is the nature of your organization? So if you could just pick the option that best fits, and the number of clinicians, as we define it here, will impact some of the requirements for reporting. So we've kind of set this up intentionally so we can address some of those differences based on the clinician size within a practice. Okay, and we'll go ahead and close this out as well. All right, so the majority on the call are small practices, 15 or less clinicians. That 15 or less, again, is going to come into play. We've got a handful of medium-sized practices, a few larger practices, and then some other vendors, EHRs that have joined us, or billing organizations that have joined us as well. So a nice spread there, and again, I think this is going to be valuable for everyone as we go through this information together. Okay, no more quiz questions for you. Now we're going to get back to the main portion of what we have for you today. So we're going to jump right into our kind of roadmap or agenda for the day, and it really starts with looking at who is eligible to report MIPS, and really what does that mean for your practice? What's the impact to your practice? Once we understand who needs to report and why they're reporting, we'll then take a look at the performance categories that you need to consider for 2017. And if I didn't mention it already, we're covering 2017 reporting. We have other webinars dedicated to 2018 reporting. If you do want information on 2018 reporting, just let us know through the questions toolbar and we'll be able to send you some information there. After we go through the performance categories, we'll go into the MIPS score, making sure that you understand how well you do or perform within your categories will impact your overall score within MIPS. So we'll break that down for you. And then finally, we'll save time to go through a live demonstration of our MIPS Pro system. So as we mentioned, Healthmonics is the name of our organization. MIPS Pro is our tool to help eligible clinicians report for MIPS. So we'll show you what that looks like and whether you report with us or not. I think it really helps to solidify what MIPS can look like as you choose your reporting mechanism to send your information to CMS. So rolling right along, so MIPS eligibility and impact. You know, as we mentioned MIPS, I hope right now everyone has some understanding of MIPS, but the overall program, the merit-based incentive payment system, you know, really is addressing the level of quality and the quality of care within practices who bill Medicare, and how well are you taking care of your patients. So, you know, this whole program is focused on that, you know, value-based care, quality of care being provided, and it's being done so by bringing together multiple different legacy programs that have existed through CMS, through Center of Medicare and Medicaid Services in the past. So a handful of clinicians or predetermined type of clinicians are eligible to report for MIPS in 2017. That changes slightly in 2018 and 2019, but let's go ahead and take a look at who is eligible, and then we'll look at, again, why should someone report, what's the impact to their practice, and why should they really care about this MIPS program. So eligible clinicians. There's two different groupings of clinicians for 2017 and really through into 2019 and beyond. There are those clinicians that are immediately eligible to report for MIPS for 2017, and that group includes, as listed on the right here, the physicians, physician assistants, nurse practitioners, and so on. So this group is required to report for MIPS in 2017. And we note here both the performance year and the adjustment year, because as you report for MIPS in a given performance year, your Medicare reimbursements will be adjusted based on how well you do with your reporting 2 years later in the adjustment year. So whether you report successfully or report very successfully for MIPS in 2017, that's going to impact your Medicare reimbursements in 2019. The second group of eligible clinicians are those clinicians who become eligible in the 2019 performance year. So starting in 2019, this group of clinicians would be required to report for MIPS and have their reporting from 2019 impact their Medicare reimbursements or adjust their Medicare reimbursements in 2021. So that grouping contains the physical and occupational therapists, speech language pathologists, audiologists, psychologists, and so on. This group does not need to report in 2017. So again, 2019 eligible clinicians, as such as we list here, you're not required to report for 2017 or 2018. You can, though, choose to report and gain valuable feedback on the reporting process, on your performance in MIPS and MIPS measures, and gain really insight into how well you're doing so you're further prepared for when it really matters. So you don't have to, but you can for that group who is 2019 eligible. There are other ways that MIPS eligible clinicians can be exempt from reporting in 2017. So those clinicians who are newly enrolled in Medicare for 2017 would be considered exempt from MIPS reporting. Those who are below the low volume threshold, and I'm highlighting again, this is 2017 as some details do change for 2018. For 2017, the low volume threshold is billing less than or equal to $30,000 in Medicare Part B, or seeing 100 or fewer Medicare Part B beneficiaries. So if you meet either of those numbers or below, you are exempt. If you are above both, then you would be required to report for MIPS. So this is really CMS establishing the MIPS program with some opportunity for those clinicians who might not have the resources if they have smaller billings in Medicare or smaller amount of Medicare beneficiaries. They don't have to immediately report, and they can take more time to understand the reporting requirements and program and get their workflows and systems in place to help them out once this low volume threshold changes in the future. Additionally, providers or clinicians who are participating in advanced alternative payment models would not need to report for MIPS. Under the larger quality payment program, there's different tracks for advanced alternative payment model participants that will lead to incentives and quality reporting tied to the value-based care initiatives of the quality payment program. So another aspect of MIPS that we want to look at is how you choose to report your MIPS information for your eligible clinician or clinicians. So as in years past with programs such as PQRS, clinicians can choose to report at a group level by their tax ID combined or at an individual level by each NPI within a practice. So this is a decision that clinicians can make or administrators can make to determine what is really going to work best for your practice. There's a lot of things that can impact this choice, whether you report as a group or individual, but what it allows is that if you report as a group, all the performance gets rolled up into your group. You're looking at your MIPS score as a group, and you're going to be penalized or incentivized as a group as well. Whereas if you report individually, you'll see your performance and score for each clinician individually, and each individual will have incentives or no penalty or a penalty tied to their reporting based on how well they perform. Now, for the group or individual choice, you must maintain the same level of reporting across all performance categories. So if you're reporting on, say, quality and improvement activities for 2017, you need to report for both as a group or individually. Similarly, if you're doing ACI and quality, if you choose to report ACI individually, well, you need to report quality individually as well. So it's an important piece. One of the things you can consider as you get started, as that might also impact how you go about collecting data from your system, how you might adjust your workflows moving into 2018, and really what data you're looking for from your eligible clinicians. Now, there are other impacts to your reporting based on whether you choose to report as a group or individually. So some clinicians might be included in MIPS reporting if you choose to report as a group, whereas they might be excluded if you're reporting individually. So here we break down who's included and who is not included while reporting as a group. So if you're reporting as a group, clinicians who would individually qualify for the low volume threshold would be included within the group reporting. So let's say a clinician only sees 50 Medicare beneficiaries and bills 10,000 Medicare Part B, but their group or their practice is reporting as a group, they would then be included within the group reporting. Clinicians who are newly enrolled in Medicare would also be included, along with QPs or partial QPs, which are clinicians participating in alternative payment models. Who isn't included, clinicians who simply do not bill Medicare Part B would not be included within a practice's reporting if reporting as a group. Additionally, those clinicians who are exempt until 2019 are not going to be included in your reporting. So for example, if you have some LCSWs or psychologists in your practice and you choose to report as a group, they will still be considered exempt and will not be rolled up into your reporting. Groups that bill less than or equal to $30,000 or less than or equal to 100 Medicare Part B beneficiaries, if your entire group is below the low volume threshold, you don't need to report. That makes the entire group exempt from reporting. So let's say you've already decided you're reporting as a group or you're reporting individually. Another big piece of MIPS is understanding the impact. What can this really do for your organization? You understand that you're going to spend some time and effort to collect information and report it. What's the benefit to you? So MIPS has penalties and incentives tied to performance. So how well you do will impact whether you can achieve incentive payments or penalties on your Medicare reimbursements. So by not reporting in 2017, a clinician or group of clinicians would receive a 4% penalty in their Medicare reimbursements in 2019. Alternatively, if a practice or eligible clinician reports and does well, they can receive up to the 4% positive adjustment with additional opportunities for high performance bonuses such as the 3 times multiplier and a 10% exceptional performance bonus. So that might look great, and as you see, the right side is a lot bigger than the left side of this graph. One thing to note that's important with how the adjustments work is that MIPS is a budget neutral program. So CMS anticipates the amount taken from clinicians who report unsuccessfully or do not report will be used to pay out the incentives to those who report well. So they feel that a large amount of clinicians won't report, and those penalties will fund the successfully reporting clinicians. Additionally, there is a budget of $500 million available throughout the entire MIPS program to pay out incentives for clinicians who have high performance. And as we see here, moving into later years of the MIPS program, the incentives and penalties will continue to grow. So if you are considering not reporting MIPS, or have your fingers crossed that all of this is going away, I implore you, make sure you at least report enough to avoid the penalty, and then see how little it might take to earn some incentives. And if you are in a position where you've got the resources and can put them wholeheartedly towards reporting, go ahead and work toward maximum incentives, because 2017, in all likelihood, will be the easiest year to earn incentives, because people, clinicians, practices are still learning about the program. So I think this is a great opportunity to dive in. Now, additionally, when we consider the impact to your practice, it's important to note that a clinician's performance within different quality measurements and other performance categories in MIPS will be posted to the Physician Compare website, showing how well you're doing in the different areas of MIPS compared to your peers. So if a Medicare beneficiary wanted to compare different clinicians and their performance in, say, different quality metrics, they could take a look right online, compare, understand, and make decisions on who they want to receive care from based on that performance. So that reputational impact, we think, is important to note, as well as the financial impact that we've already went through here. So now we understand some of the why. Why do you want to report and why you want to be successful within MIPS? Now we're going to look more at what you need to report, what is being measured within the performance categories. So as I mentioned earlier, MIPS really brings together or streamlines multiple programs that have existed under CMS, including PQRS, meaningful use, and the value-based modifier. And the intent is to focus all of these different areas on performance and make one cohesive system, and you can argue with me on the word cohesive, but one cohesive system that will enable CMS to award those who have high performance, then penalize those who do not participate. So what that translates into is the shift of those legacy programs into performance categories within MIPS. So we have PQRS, which is now referred to as quality, meaningful use, which is now referred to as ACI, or advancing care information, quality improvement initiatives, which was not a formal program under CMS in the past, but something that many clinicians engaged in, is now recognized as IA, or improvement activities. And then the value-based modifier is now referred to as cost. So this cost component is actually becoming a part of MIPS in the 2018 reporting year. So for 2017, you are not required to report for cost. And in 2018, it's going to be calculated automatically from your Medicare claims. So it's going to be something that goes directly to CMS. So here's how the performance categories break down and impact your overall MIPS performance score. So quality, replacing PQRS, is 60% of your MIPS performance score. ACI is the next highest amount of your MIPS performance at 25%, and then improvement activities at 15%. So we're going to go through each of these and tell you more about what those performance categories entail. And keep in mind, as we're showing here, the quality is going to be the highest point value within the MIPS program. And I'd like to point out as well that as you report for 2017 and prepare to shift gears into 2018 and future MIPS years, these weightings of the importance and point value within MIPS is going to change. So this will look different for 2018 reporting compared to 2017 and so on in future years of MIPS. When we look at quality, quality is reporting for different metrics or measures that have been identified by CMS and other organizations to really, again, look at the quality of care that's being provided. So of a large number of different measurements that can be reported on, you have to choose at least 6 measures to get the full points out of the quality performance category. One must be an outcome measure, which is a predetermined type of measure identified by CMS. And if an outcome measure is unavailable for you or your clinicians, then a high priority measure must be reported. There is a 7th measure, the all-cause hospital readmission measure, which applies to groups of 16 or more with at least 200 applicable cases. And if you are not selecting individual quality measures to report on, you can alternatively report on a specialty-specific measure set. And the measure sets were identified by CMS to really make it easier for clinicians to find measures that make sense. I think that some specialties struggle finding relevant measures for their clinicians, or even subspecialties might have an even harder time. So the specialty-specific measure sets is a great place to begin, understand what measures CMS already recommends. And I'll mention as well that we have a resource, a great resource of the measure details available on our MIPS Pro website as well. And we have those broken down by specialty too, that can make the quality measure selection process easier. For 2017, you are also looking to report quality information for 50% of all payers. Now, I like to say this about 3 times when I share this information because many people are not used to that level of reporting. But CMS is looking for 50% of all payer data for the quality measures you choose to report on. So if you have, say, reported on a measures group in the past, or haven't reported for PQRS in the past, this might be a lot of information. So it's really important that you look at your workflows, make sure you've captured appropriate data, or have a system in which you can extract that data to get to that 50% threshold. And a question that often comes up is, well, why am I reporting on non-Medicare payers when this is a Medicare program? CMS has said that they do want to see 50% of all payer data, and they have acknowledged as well that currently they do not have a way to validate the data that is non-Medicare related. Nonetheless, they have asked for all payer data, and I think what's important here, why you would actually want to report for all payer data, is that other payers have looked at the quality payment program, have looked at MIPS, and said, we like what CMS is doing here, and we might adopt this type of reporting. So again, looking at your workflows, making sure you have the systems and tools in place to capture this information and organize it in a reportable way is going to be critical, not only for just meeting MIPS requirements and checking the boxes now, but in anticipation that you might be asked for this information for other payers down the road. So figuring out how to accommodate that now is important. And we know here as well that that threshold of reporting, 50%, will ramp up toward 90% in future years of MIPS. So we're going to move on to ACI. And ACI, or Advancing Care Information, again, replaces the Meaningful Use Program. So this is really focused on how well you're using your EHR or electronic healthcare record technology, how are you engaging with it, and what does your performance look like in certain measures of EHR use as well. So for ACI, you're reporting on a minimum of 90 days within identified measures, and you need to report using a certified EHR or EMR that's certified to the 2014 or 2015 edition. So for the majority of EHRs, they're on the 2014 edition technology, and many are now shifting into that 2015 edition. So if you're reporting on 2014 or using a system that's a 2014 edition certified technology, you're going to report, and there's certain measures that you will be able to consider for reporting on. If you are using a 2015 edition technology, you'll actually get bonus points for utilizing that level of technology. Now, this will be required in the future that you are going to use 2015 edition technology. So it's important now to make sure that your EHR has plans to update its certification to 2015, or if you are now adopting an EHR or shopping EHRs, make sure that they plan to be 2015 certified in the near future. And again, depending on the certification of your EHR, there are different measures that you would consider reporting on based on the capabilities of the certified technology. For ACI, you're looking at 2 different types of measures. There are base measures and performance measures, and really that splits the really type of measure you're reporting on into something you can just report and say you did it, a kind of attestation, compared to a performance measure where you're indicating the number of denominator eligible patients and how many patients met that particular measure. So you must report on at least the base measures for ACI, and then by reporting on additional performance measures, you're going to earn more points within the performance category. Moving right along, within ACI, there are additional exemptions. I think CMS understands and recognizes that some clinicians don't have EHRs. And the result of that, or I should say the result of that, or not having to use an EHR, is that there are additional exemptions to allow certain clinicians to not be penalized if they're not using an EHR. So the type of clinicians we list here: hospital-based, physician assistants, nurse practitioners, clinical nurse specialists, registered anesthetists, and clinicians who lack face-to-face interactions with patients. If you fall into, or your clinicians fall into these categories, they are actually exempt from ACI, and their score for ACI will be reweighted into quality. So they won't be penalized for not utilizing an EHR, and that point value will then shift into the quality performance category. And this is an automatic exemption, so CMS will know if your clinician is considered one of these clinician types and adjust your MIPS score accordingly. Additionally, ACI exemptions exist based on hardships. So there are a few different scenarios in which a clinician can apply for and receive a reweight of ACI and be exempt from ACI reporting. Those include insufficient internet connectivity, extreme and uncontrollable circumstances, and then lack of control over the availability of certified electronic health record technology. So I'd like to point out that for extreme and uncontrollable circumstances, CMS has identified an automatic process for those who have been impacted by catastrophic events such as the hurricanes that existed or occurred last year, and has identified clinicians who should, because of those catastrophic events, receive a exemption from ACI. If you need to or want to check in to see if you fall into one of those categories of automatic exemptions, you can check directly with CMS. And then finally, with lack of control over the availability of EHR technology, that doesn't necessarily mean that you can't make the final decision on purchasing an EHR, but really a larger inability to control or have an EHR within your practice. Moving right along, improvement activities. For improvement activities, you're looking at different actions or activities that will impact the practice as a whole. And there's a list of over 90 activities that you can choose from, and they are broken down into high weight and medium weight activities. So the high weight activities are worth 20 points, and the medium weight activities are worth 10 points. And you're targeting a total of 40 points within the performance category, but there are a number of clinicians that are only going to be required to earn 20 points. So those clinicians who are in small practices, as we defined it earlier, 15 or less clinicians, you are actually only required to earn 20 points in improvement activities. So that could be met by reporting on one high weight activity or reporting on two medium weight activities. Also, if you are considered in a rural setting as part of an HPSA or considered non-patient facing, then you only need 20 points within improvement activities to get the full point value. And for improvement activities, it's really an attestation. So you're going to report and attest to CMS that you're performing the given activity within your practice. And you can choose, again, from a list of different activities that are broken down into different subcategories to find an activity that makes sense for you or you are already performing in your practice. All right, so now we've covered each of the performance categories for MIPS in 2017. We want to look at how you can submit your MIPS information to CMS. So here we have broken down the different performance categories as well as the different submission methods for your MIPS information. So as we look at the first three, a QCDR, qualified registry, and EHR, each can report on all three performance categories, And if you're not familiar with the term QCDR, that's a qualified clinical data registry. And different than a qualified registry in that a QCDR is typically tied to a specialty society and looks at collecting quality metrics and information on a larger scale than just reporting to Medicare or to CMS. And then qualified registry, that's what we are, or our MIPS Pro system is, a qualified registry. And an EHR system that you're using. And really, it's important to note that each of these methods might have different levels of available measures to report on. So as you consider your reporting or data submission method, you should make sure that that method you're considering can report on the measures that you want to report on. You can report quality data through claims, but not report ACI or improvement activities through claims. Additionally, through your administrative claims, you can report on quality, but not ACI and not improvement activities if you're reporting as a group. For the CMS web interface, it's only available for those reporting as a group, and groups can report through the CMS web interface for all 3 performance categories. And then finally, the CAHPS for MIPS survey is going to be available just for groups reporting quality. Okay. So now we've thought through, why we need to report MIPS, what the impact is on your practice, whether you're reporting as a group or individual, and what you're doing in each of the performance categories. The next step is to consider how the scoring works, which will impact what the potential incentives or penalties can be on your practice. So we've got in mind the 3 performance categories. Now we're going to look at an example of what your MIPS score could look like. As a refresher, we've got 3 different performance categories, and they break down into different weightings, with quality being the highest %, advancing care information being the second, and improvement activities being the 3rd highest % of the MIPS composite performance score. So as we go through our example, we're going to look at the potential points you can earn within each performance category and the weighting, as we just reviewed, of that performance category compared to your overall MIPS performance score. So for quality, you can earn a maximum of 60 points within the performance category. And let's say we've reported on 6 measures and done fairly well within those measures, so we've got 48 out of a possible 60 points. So that performance rate is going to be 80% within the performance category. And we have to consider that 80% performance rate against the performance category weighting, which is 60%. So the MIPS score for quality in this example is going to be 48%. Now this math's pretty easy for quality because there's 60 possible points and the performance category is worth 60% of your score. The math doesn't work out as cleanly in future years, so we want to make sure you're thinking through your scoring in this manner. Now for advancing care information, let's say we've reported on our base measures, which is going to make up at least half of our score within the performance category. We've reported on additional performance measures, giving us additional points. Now we've got 70 out of 100 points within advancing care information. Well, we can take that point score and the performance weight or rate and then look at that compared to the weighting of the performance category. And then we get our MIPS score of 17.5% of the overall MIPS composite performance score. And then finally, for improvement activities, this CMS expects everyone to get 100% on. So let's assume that we report on 4 medium weight activities or 2 high weight activities. We get the 100% score. The performance category is worth 15%, so we get our 15%. And that leads us to the total score of 80.5% in this example. So we've got a score for this example. Now let's connect the dots and show you what that could mean for your practice. So the scoring tiers break down such that you can avoid the penalty, gain some incentive, or gain a large incentive. And really start at the beginning. If you choose not to report or somehow report something that isn't what CMS is looking for, you're going to get penalized the full 4% negative adjustment. So for the penalty, it's really an all or nothing. If you get 0 points, you get a 4% penalty. If you do something, you're likely going to get the 3 points to avoid the penalty. So as I just said, 3 points allows you to avoid the penalty within MIPS for 2017. This can be accomplished by reporting simply one quality measure or one improvement activity or the base measures within ACI. So again, at the very least, if you're spending time to learn about MIPS on this webinar or have spent time invested in other resources, at least avoid the penalty, get your 3 points, report minimally, and then shift your focus into other initiatives or for MIPS in 2018. Now, if you are collecting MIPS data and can gain more than 3 points, anywhere between 4 and 69 points will make you eligible for some positive adjustment. So for the positive adjustments, it's not an all or nothing. You can earn somewhere between 0 and 4% in positive incentives paid out based on how well you do. So your score between 4 to 69 points will impact whether you get closer to 0% or 1% or 4%. So the better you do, the higher in potential incentives you will earn. And to do so, you will want to report on a minimum of 90 consecutive days of the reporting year. Now, if you are fully participating, you're doing all your quality measures, you're doing ACI, improvement activities, you can potentially get within the 70 to 100 point range. And what that does is it will make you eligible to earn the 4% positive adjustment, as well as be eligible for the exceptional performance bonuses that we talked about earlier. So the higher you get in point value, the more you can earn. And again, if you're getting 100 points, you're going to get the max or most in positive adjustments. If you're getting 70, you might not get as much. So understanding your performance as it matches up with these different tiers is going to help you understand what you can potentially earn. And once again, because MIPS is considered a neutral program, the amount available to be paid out in incentives, how well does a 5 points get you in adjustments compared to a 60, will be determined based on how much is available in funds to give to those who are earning incentives, as well as how well individuals perform across the board within MIPS. All right, so we've covered a lot. We want to spend the last bit of time we have with you going through our demo of MIPS Pro as well as answering questions you have. So we're going to just take a few moments to bring up our MIPS Pro system, and then we'll be able to walk you through a demonstration and then answer additional questions before we wrap up. So just a moment, and we'll be back with you to share our demonstration of MIPS Pro. Okay, thank you for your patience as we brought up our MIPS Pro system to show you a glimpse of what MIPS reporting can look like. So what we now have on your screen is the dashboard for a practice reporting with MIPS Pro. And as you'll notice immediately, what we're looking at is the total MIPS score that we have at the top right here, and a breakdown of the MIPS score within each performance category. And with MIPS Pro, clinicians can choose which performance categories they want to report on So if they're only reporting quality with us, we'll only show the score for quality. Now within this, we have the breakdown as we kind of went through our example of the score within each performance category. And you'll notice at the bottom here, we also have an option to look at the potential impact that MIPS reporting can have on our revenue. So there's some tools there to estimate or kind of account for what that impact might be using different assumptions provided by CMS. We also have our quick links here on the left-hand side, looking at the profile of our practice or of our provider. If we wanted to jump directly to our submission tools, which a lot of clinicians are now in the system and submitting data to CMS now that we're into 2018, we can review our patients, and then we can also look at any uploads within our system that might have occurred from information where we're importing directly into MIPS Pro. So we're going to use the quality category to demonstrate the most of our system, as most performance categories, or each of the performance categories here, follow a similar format. We break down the performance categories into options here, so kind of a checklist that you have that will walk you through each step of the way. Starting with quality and starting with our measures, we need to pick out what measures we want to report. So we can go here to My Measures, and we already have in this account that I'm using to show you MIPS Pro certain measures picked out. We've got 8 out of 6 measures picked out. So we have to report a required 6 measures to get our full score, but MIPS Pro will let you track performance on more than 6. So here we have our selected measures. So we can see we are reporting on in this account for hemoglobin A1C, we've got care plan, influenza immunization, and documentation of current medications, along with other measures. If we wanted to review, we could see our direct details for a given measure, and this is going to include whether it's a high priority measure or outcome measure, how often the measure needs to be reported, the instructions, benchmark information, and the applicable codes that will apply for this given measure. So if you are picking out your measures, let's say you registered for MIPS Pro, you picked out your measures, you can come here and gain an understanding of what codes do you need to look for in your EHR to pull and then upload into MIPS Pro. We also list the numerator or performance codes that need to be included to indicate how well you're doing or if you're meeting the particular measures. So let's assume we have not picked our measures. We can go into Select Measures, and MIPS Pro is going to provide a number of different ways to search for measures applicable for your practice. So we can report on any of the 243 registry measures that are available. So if you have if you are comparing reporting methods, registry reporting is going to have the most available measures to choose from compared to EHR claims-based reporting. And you can search these measures by measure title, measure number. If we wanted to type in codes, let's say your biller or you are very familiar with certain codes, you can type in a code and search what measure might be met by that particular code. You can search the CMS measure sets by specialty, as we discussed earlier, and find applicable measures. And there's a number, again, of different ways that we can look for measures that are going to apply to our practice. So once we select each of our measures, we'll have the same kind of visual to show us that we have met the requirement of 6 measures and at least 1 outcome measure. And if we don't want to report on 6, you can let us know through the system, and that will still let you report on less measures, which again is okay for 2017. You're just going to get less points, but if you report on less than 6 measures, you can certainly still avoid the penalty. So we could jump back to My Measures from this page, and we can also go back to our quality checklist. So let's say we picked out our measures, which we did in this measure section. There's some other steps related to electronic reporting and mandated measures, which are pretty straightforward. You walk through and indicate information to MIPS Pro so it can adjust accordingly. Then we get into really the important piece, data entry. So Ideally, with MIPS Pro, you are taking reports or data reports from your EHR or EMR or practice management or billing system and uploading that data into MIPS Pro. And I should say that's how many clinicians are using our system. The ideal scenario is that we are able to interface directly with your EHR, form a direct connection, and that data flows over directly to us. If you are interested in that option, we can certainly talk with you to determine if we already have a connection with your EHR or explore how we might build one with your EHR. So we've got the tools here for the data integration. I'll just show you briefly. As we go into here, we have the option to import from EHR or upload visits or just upload patient information. If we're uploading visits, we have templates that you can download to see what specific data points we're looking for. We list out the different type of industry standard formats that we can accept, such as CCD, CCR, QRDA. And when you have the data report ready, you can just drag the report and drop it into MIPS Pro, and then it will upload the data and calculate against the measures that you've selected. So let's say we've uploaded a data report into MIPS Pro. I'm going to go back to my quality checklist, and I can review that data in our system. Now, there's a couple of ways to do that. This visual we're looking at now is going to show us a representation of each patient visit and how we're doing in each measure. So the real benefit or value of this screen is that I can get a visual sense of, am I not meeting a particular measure? Are there a few measures I'm struggling on? Or is there an impact to my performance on particular dates, or are there particular high-risk patients that I want to look at more closely? And you can use these filters on the left-hand side to dig into the data a little more deeply. So if you wanted to say, look at your visits on a particular date, you can do so. If you're uploading data for multiple providers, you can filter by NPI and take a look at specific visits per provider. You can look at specific measures. So again, there's a lot of different ways to look at this. We've got the legend here so you understand what all these marks and symbols mean, and can gain more insight from the data that you're putting into our system. If you do need to manually adjust any information in our system, you can click right into a particular visit, and then you'll be provided with the data in the sense of any codes that you upload into our system, as well as a more meaningful way to review the visit, which is represented by questions related to the measures. I do like to highlight here that if there are particular codes, you can punch those right into the visit, and it will calculate or adjust the patient visit based on what codes are being included. But as I mentioned, the way MIPS Pro translates this information is the codes that you are putting into the system or uploading are translating into, did a patient meet a diagnosis, was a particular encounter noted, and was a particular outcome achieved. So each of those codes is going to mean something in our system, but if we wanted to say change one of these answers, if something was coded incorrectly, we can go and do this manually in the system, or we can rerun the report in the EHR or billing system, upload it again into MIPS Pro, and adjust the information that way. There's a lot of flexible ways you can adjust information in MIPS Pro. So let's say we do want to, we understand kind of how we're doing, but we really want to look at performance. Our performance page is going to show you across each of the measures what your performance rate is like, and give you a real sense of how you're doing. So here we can see each of the measures we've selected within MIPS Pro, the number of total instances, how many are complete, so we can consider what information we may need to add or capture that we're not capturing, how many met the particular measure, and what our performance rate is here. So, if we look at these, we're doing pretty well. As you may know, measure number 1 is an inverse measure, so a low performance is a good thing. And a great thing about this page is if we wanted to, jump into those visits where we are not meeting the measure or might have incomplete information, we can click on any of these links and jump into all of those who met measure 47 for care plan, and now I just have those measures listed here. So it makes it easier to navigate back and forth and really hone in on information that you might need to address within your workflows or how you're capturing information. We'll jump right back to the performance page. We've got an additional page that shows performance against the deciles. We do have the flexibility to show you your performance based on different time frames. So if you wanted to look at the first 90 days or last 90 days, or just report on the first or last 90 days, you can upload all your data into MIPS Pro, adjust as you go, or view within the system what that performance looked like prior to submitting that data to CMS. We'll also highlight your top performing measures so you can see exactly which are going to lead you to have the highest score. So we'll kind of bring those forward to you, as well as show you what bonus points you're earning within those measures. So as we're running out of time, there's a lot more we could show in MIPS Pro. I know we didn't touch on the revenue impact estimator or the other performance categories. If you want to take a deeper dive into MIPS Pro, happy to go through that with you. We'll send you some information of how you can get in touch with us to follow up on that conversation. Now, what we're going to do very quickly is just try to answer some additional questions that you may have asked within the last few minutes here. But as we're reviewing those questions, I do just want to close with a couple of the kind of summary points of the webinar today. So again, takeaways for what we've covered today. You want to look at which of your clinicians are eligible to report, understand what the impact of MIPS is on your practice or organization, review the performance categories and make sure you're capturing the right information, and then really choose, do you just want to avoid the penalty for 17 and start focusing on 2018? Or if you've been collecting information, let's go ahead and put that all together and report and see if you can gain some meaningful incentives. Select your data submission method and start reporting. It's that time of year. With MIPS Pro, we do recommend that clinicians register and finalize reporting in our system by February 15th. There is some flexibility with that date as well. So if you haven't started yet but are interested, please contact us and we'll help you out with getting started. Some additional ways you can contact us is through our webinars at healthmonics.com email address. You can send us questions there. And there's some additional resources linked up on this page that, again, we'll send out to you by email so you can review and share within your practice to gain benefit even after this webinar. So I'm going to review quickly here, see if there's any questions we can answer for you in the last few minutes here. Okay, so we've got one question. Is there MIPS for pathology and lab? So pathologists can report for MIPS. We do have specialty recommendations for pathology. So happy to send you, I believe that individual did have the link sent to them for what measures we recommend for pathologists. Okay, another attendee asked for information on 2018 reporting. That individual did have our link to register. If you do want to learn more about 2018 reporting, go ahead and just send a message within the questions toolbar now. We'll be able to send you that registration link, or shoot us an email at that webinars@healthmonics.com email address, and we can also send you the 2018 webinar link there as well. Okay, another question. If you are a non-eligible clinician in a practice that is reporting as a group, will your reimbursements be increased the same as the rest of the group in 2019? So that really depends on what type of exemption you have. Again, we use the example often of psychologists. If you're a psychologist and your group is reporting, you will not have your reimbursements adjusted. But if you are, say, a nurse practitioner who bills only a small amount of Medicare Part B and your practice is reporting as a group, you will have your reimbursements adjusted in 2019. Okay, Just looking for any other questions I can answer. All right, and let's go with this as the last question. Is your MIPS Pro available for the full year so practices can enter data in real time and follow their progress throughout the year? So the answer is yes. MIPS Pro is there to allow you to report throughout the year. And for 2017, we're past that time now, so it's all going to be retroactive, looking back, adding information. For 2018, you are able to register for MIPS Pro for 2018 at this time. We're still updating the measure specifications for that reporting year as CMS releases new measure specs every year, so we have to adjust for that. So you'll be able to begin adding information soon, and then once that essentially has all been updated, you can track throughout the year. So if you do want to get started with 2018, happy to connect further and make sure you've got all the resources and links to get to the right place to make sure we can help you out. So thank you all once again for joining us here today. It looks like a few of you have asked for the link for the 2018 webinar. We're going to hang on in silence for a moment to make sure all of you get that link who need it. If you want to send us an email and get to that later, please feel free to send it to webinars@healthmonics.com, and we can hook you up with that link as well. And again, we hope that at the very least you do avoid the penalty for 2017, report at least the minimum, and really prepare for 2018. But if you've got the data and if you got the resources, shoot for the incentives. 2017 is going to be the easiest year, and we'd love to help you out with that. So thanks again for joining us today, and it looks like we'll be seeing many of you on the next 2018 MIPS reporting webinar as well.